You can't just skate along on 20-year-old vigor. A stem cell gone wrong is cancer. It's the one pill that treats everything.
Who are you? What the hell are you doing here?
You know what? I am an orthopedic surgeon, but my entire body of research has been in aging and longevity. And then in 2012, I realized that women make 80% of all the healthcare decisions in this country for ourselves and everyone we touch. And yet, women themselves had no idea, and they're completely disempowered from the ability to change the trajectory of people's health. So I focus on those three areas. And the reality is, although I've met two here at this conference, that I think I'm the only one in the world, the only orthopedic surgeon focused on performance, focused on longevity, who cares about the health of women. And I can tell you that the need is so great. I would like to raise an army of people to care for women, because the reality is also women are the 51%. We're not the minority, except the minority in research funding, the minority in venture capital investing in their health, the minority in access to care. So I appreciate the opportunity that in spreading the word that you're doing.
Sure. I want to know why is it that my mom and my girlfriend bust my chops about my health then?
Why they bust your health about your chops? Well, maybe they love you.
I know, like, because you're saying that women do most of the decision making.
That's right.
So why is that?
Why aren't they just making decisions for you then? Or
Yeah.
yeah. Why do the women make most decision making? Well, I think, and this is just so general, I hate to even say it, because there are plenty of men who are caretakers. But that is a role that women have traditionally played. It's probably within our DNA. We house babies for 10 months, right? We're caring for this. And so that just extends into our lives. And so I think we do it naturally to take it upon ourselves to say, hey, have you ever had your blood drawn? You're reaching whatever age, like my sons are approaching 40, and I'm like, we really need to establish a relationship with your health at this point. You know, you can't just skate along on 20-year-old vigor.
I mean, I see it even with my father. My mom's making his appointments, pushing him.
That's right.
Stop nagging me. I'll go when I feel like it, right? And like, so there is something there, and that's why I wanted to ask, like, really psychologically, because I understand that women are caregivers, and because they birth the child, I feel like the responsibility kind of falls on them,
Probably
right?
the truth.
I mean, even with me, like, I have a son. It's not my girlfriend's son,
Yeah.
and I care for it, but she's always one step ahead of me when it comes to that stuff. So
How lucky you are.
I'm very lucky. He's super lucky for sure. Okay, let's choose one. Stem cells, peptides, exosomes for longevity. Which one's a real winner and why?
So, my point of view comes from a place of having done some of the original research. This is not my opinion. This is not me reading somebody else's research. This is when I was an academic surgeon at the University of Pittsburgh. I collaborated with a brilliant PhD named Johnny Huard, and we were some of the first. I say we broadly. He was some of the first, and I happened to be doing work with him on what are now known as satellite cells, muscle-derived stem cells. So from that perspective, I believe the body is capable of healing itself. What I believe, however, is even this many years later, almost 30 years later since I was in that laboratory, um, we don't know all the answers. And biology, in my opinion, cannot be messed with, meaning a stem cell gone wrong is cancer. So people deserve thoughtfulness, investigation. So if you give me those three, right now, the state of the art is stem cells, autologous stem cells, meaning coming from the person, either from the bone marrow or the fat. Fat is FDA approved. Bone marrow is used all the time in surgery for a variety of indications. And even with stem cells, we're still trying to understand what dose do we need? What cell surface markers are the stem cells we need for this application? Because there are pluripotent stem cells, meaning it can become anything. And then there are tissue stem cells, like muscle-derived stem cells from fat, right? So the science is evolving, but the practice has rushed ahead, not even waiting on science. And so I use stem cells for regenerative medicine, regenerative orthopedics. We use it on tendon, ligament, for arthritis, and people see fantastic relief of inflammation. Tissue does not grow back. For a tissue to grow back, you need a scaffold, something to grow on. You need a cell, and you need a growth factor, right? Now, one of the second things you mentioned, exosomes, I think are well on their way. So just in case no one's been listening, I'm sure everybody on your podcast or your channel knows, but exosomes are sacs of growth factors that the stem cells make. The cell outside is made of polysaccharides. So for lack of a better way, the cell puts the products of its metabolism against the cell membrane, and it sprouts off as an exosome. So you get the benefit of a stem cell without the cellness of it. And they're not legal in the United States yet. They're used all over the place, therefore completely unregulated. Do I think they're coming? Yeah, I really do. It's just if I'm answering you as people deserve the best care, not experimental care, we're not quite there yet, but we'll get there.
Do you think it's worth going to another country for treatment, or should people wait?
I think that um, buyer has to beware. Other countries have fine doctors, but they do not have the same regulations of protection. And sometimes that's good because you get what you want, and sometimes that's very bad. So I think if you're going to go outside the United States for some biologic treatments, you have to triply do your homework. Who's treating you? What is the cleanliness standards? What are they actually putting in you? Because I'll tell you from a stem cell lab perspective, a cell coming in a jar is dead. So if you want live, they have to be, that's why autologous stem cells are so good.
So, we're always pointing fingers at the current medical system. Do you think they're actively sabotaging our longevity?
Oh, no. I don't think doctors listen, I spent 22 years of my education formally training. I would not have wasted my entire youth trying to sabotage people's health. I did this to help people. But here's the status of healthcare in this country. Your insurance, this community that's here at this conference will pay for healthcare out of pocket. They will pay for what they want because they see the value. That is not the case for the majority of people, at least in this country. They expect insurance. A, a I think there needs to be a more possession of our own health outcomes, which is, I think, what this community does. They're like, I want to be healthier. I'm going to seek out the answers. I don't see that everywhere, number one. Number two, this community is willing to spend their hard-earned dollars to get what they want. Outside of this community, many times, whether by need, and I'm not trying to blame people, but by need or by choice, they want to spend their insurance money, which is fine. But what does insurance cover? It covers procedures, and it pays clinicians less than a massage therapist. If you went and got a massage in this city, you'd probably pay $250 for it. After 22 years of formal education and devoting my life to taking care of people, insurance will pay me $90. So volume is how doors keep open. Well, we know that volume, 15 minutes per patient, cannot take good care of a person, right? So that is the long answer to say, I don't think anybody is trying to sabotage health. I think in 15 minutes, you can't deliver as much health as people need. And there's a lot else that goes into it, but I think those are the driving forces.
So you specialize in mobility and muscular health.
Mhm.
Can we actually prevent fragility and
Frailty?
frailty and things like
Absolutely.
that?
So some stats on frailty and fragility. And I'll be presenting some of this today, but 1 in 3 women will end up in a nursing home because she passes something called the fragility line. It is the physical fitness after which you cannot rise up from a chair. We measure that in usually young, healthy people with VO2 max. So when your VO2 max drops below 18 for a guy, 16 for a woman. You literally cannot get up from this chair by yourself. You can't walk across the room, certainly can't take care of yourself, right? That is one reason women end up in a nursing home. Another reason, very frequently, um, is quite frankly, because women experience after menopause something called the gynecourinary syndrome of menopause. It's when your bladder and your pelvic floor, which is a sheet of skeletal muscle, gets so weak, and we can talk about how not to let that happen, so weak that people get a lot of bladder infections and become incontinent. Those two factors is what ends up 1 in 3 women in the United States in a nursing home. Another reason leading to frailty is poor bone density and poor muscle structure. So we know that 1 in 2 women in the United States will end up with an osteoporotic fracture. That's either me or your girlfriend, right? Me or your mother. It's like real data. So how do we get in front of that? Which is what I'm all about. How to get in front of the frailty, which can be significant. In this country, the life expectancy for a man is 76.4 years. For a woman, it's about 79. In Australia, I just got back from a speaking tour in Australia. Women live to 85, so they're doing something right that we're not doing. But we are healthy-ish until about 63. That's our health span in this country. So between 63 and death, what are we doing? We're becoming more frail and dying. The good news is that you can step in front of that. We can get in front of losing our bone density so that we don't have a hip fracture. 70% of all hip fractures are in women. When anybody, man or woman, falls and breaks their hip, 50% of the time, you do not return to pre-fall function, meaning you can't live in the house where you raised your kid, and a third of you die, men and women, right? The good news is you can step in front of loss of bone density. You can step in front of loss of lean muscle mass. In many ways, this mobility can help stave off the ravages of chronic disease. So the question about how mobility, why I'm so passionate about mobility, it's because it's the one pill that treats everything. And if I, as a surgeon, help you walk again, help you use your shoulder again, I'm not only putting metal in you, which is a fun technical thing, but I am saving you from the ravages of chronic disease, which is what this conference is all about.
Is menopause a medical failure or a natural optimization window we've been ignoring?
A menopause is a natural optimization window, which no one has talked about until the last 5 years, and now it's exploding and it will never go away again. And so I think understanding that women are more than just reproductive beings, that after we stop having the capacity to have children, the role in many animal species becomes leadership, guiding family life in a different way, right? So there are many animal species, the killer whales, um, elephants, for instance, are some of the species besides humans where we live into menopause, and then the roles change. And I see that in menopausal women. But until this very point, women haven't known enough about it. And there's this trend I see across this very long career of mine where women will say to me, "Hey, doc, I didn't want to come in today because you know what? I have a really high pain tolerance, but I couldn't take it anymore. And I want to know why we allow women to suffer." So, what this new awakening surrounding, like, listen, menolescence, which is what I call the social, physical, hormonal, psychological transition, um, is a blessing, right? We can be the most authentic, the most indefinable, the wisest we've ever been, but we have to step in front of it like anything. And so that's what's happening right now in society. We're stepping in front of it.
So do you think we're actually biohacking or just bio-band-aiding lifestyle disease?
What does biohacking mean to you?
I don't know. I ask that question all the time because, you know, it doesn't even make sense sometimes to me, right? We're out there doing these things that we're we weren't evolved to do that should improve our life or lengthen our lifespan?
Mhm. Well, I ask you that question back because my perspective as someone who's taken care of more than 100,000 people in my career, it's a lot, is that we could be healthy, vital, active, joyful, feel more amazing long into the foreseeable future if we would optimize our health in the very simple ways that we know work. We know building muscle works. We know building bone works. We know anti-inflammatory whole food nutrition feeds us, right? We know um, that cardio builds our VO2 max if done in the correct way. If I could consistently get people to invest in those three things and optimize their health, then I would be very, 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 very happy to help everyday citizens do what we do for the pro athletes I take care of, which is optimize their performance and move them into precision longevity. But what I see, because I sit in both spaces, is many people just want to skip to rifampin or skip to all the special machines we have seen in our expo today, right? Without even taking care of the very bedrock of how our body was designed to move. So I don't know for biohacking, I don't know for band-aiding, but from a clinical perspective of 100,000 patients, if I could get people to actually care about the lifestyle changes that would make their health pivot, then I think we would be in a much healthier state.
I mean, this is the thing. It's not sexy. It doesn't feel high tech to just tell people like, well, live like your ancestors live,
Walk around, eat whole foods, yeah.
right? I mean, because, even being in this space, I always feel like there should be some innovation that's extending life or making things easier or whatever. And I think it's a large part of it. Is that's what we're geared to think that like my grandfather actually knew what he was doing, right? So so someone's over 40 and still following a standard diet and not using tech like VO2 max testing or genetic panels. Are they choosing a shorter life?
You know what? There are a lot of anecdotes out there where people will tell you'll say you're in the biohacking space, you're gonna live longer, and they'll say, "Yeah, but my Aunt Minnie drank a scotch every day, she smoked a pack of cigarettes, she lived to 97."
There
Well,
are a lot of those stories though.
there's so many stories, and, out of 370 million people in this country, I don't know how what it adds
Someone's
up
gonna get
to.
lucky.
Someone's gonna get lucky, a percentage is
Yeah.
gonna get lucky, but the reality is we know by studying population data that at 63 is when chronic disease rears its ugly head, and people on the verge of retirement spend 3 days a week in a doctor's office just trying to regain some of the health that they lost between 40 and 63, right? I think we start way too late. I think people wake up, they wake up due to a lot of reasons. We're busy, we're building careers, raising young people. You and I are both doing that. We're too busy. But then you wake up at 60 and you're like, "Oh my god, oh my god, oh my god, is my health gonna last?"
Well, I think the big issue is you're waking up when you start presenting.
That's right.
And, I tell people this all the time, and I push people in their 40s because I still think it's already too late in the 40s, but at least I think there's like a glimmer of hope. And I say to them, I said, everybody is sick. You're either presenting or not presenting,
Interesting.
right?
Mhm.
And I mean, we recently just had like we're all healthy in the space, because we understand. And one of the team members has a fatty liver. And, we found out because we were interviewing a guy who has Deliverance, a great product, and
Mm.
he was like, "Well, 1 out of 3 of you are gonna have a fatty liver." I'm like, "Fuck does this guy know?" He's trying to sell me some bullshit. Scan, scan, scan away. He was right.
Fatty liver.
And this is a healthy person who exercises, eats well, blah, 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 blah. We're not talking.
50-year-old woman?
Yeah, 42.
Year-old
Woman,
woman.
yeah.
Well, the only reason I brought that up is because menopause itself, loss of estrogen itself predisposes you to enough lipid changes to you have non-alcoholic fatty liver, the very hormone changes. So she may be doing all the right things, but if we, it becomes part of the ovarian attrition.
Well, I think, the premise of this show is to put the information out there and the knowledge.
Yeah.
And this is why we stress these things. Because, he said you should get scanned once a year after 40. And he'll tell you that 6-year-olds have fatty livers, 15-year-olds, and in high numbers, not just like cases. I'm talking like 15 to 30% of those populations, which is insane.
It's insane.
Because under 25, you should be a perfect specimen, no questions asked.
Yeah, but look at the childhood obesity in this country. 17%, I believe, is the stat. I could be a little wrong about this, but 17% of children have diabetes, which is devastating, right?
It
It's
is.
setting people up for a lifetime of death.
I mean, I see it. I see what I'm blown away that you go to a school as an adolescent and that standard American diet is just complete garbage there. And they're not even trying. And that's what the crazy part is. And again, and so it's that, and then it's a reinforcement at home because there's no education behind it. I mean, I see it with my own kid. I sit there and I count his carbs because I'm like, holy shit, he's a carb monster. And I understand that he's young, he's running around, he's like burning,
Yeah, to me.
you know, um, but it's not just him, it's all of them. And now obviously it's hurting them at a young age.
But you know what? My take on that, and I'm sure you feed him all the whole beautiful things that you have to have done in your space, you have to do. Um, we are a blended family of 6 children, right? So what I've seen over the years in our family, now it's not that they don't eat bad things, come on, but I didn't buy any baby food for my baby because I eat so healthy. I smashed up my food. She never acquired a taste for juice, never acquired a taste for crazy, terrible food so my point being, if you want healthy children, learn to be healthy yourself because they're little mimics. I'm on the floor foam rolling, she was on the floor,
Yeah.
right? They just wanna be happy with you.
Yeah.
So, and this is not pointing fingers, it's pointing at me. My children love Cheetos and all the stuff, but they know not to eat it, and they're all healthy at this point. So I just almost plead with the parents, even if it's generational. Now we've got 3 or 4 generations where if great-grandmother was unhealthy, if grandmother was unhealthy, and it just goes down the line, whole families are unhealthy, it becomes the norm.
Yeah. I mean, I think education is a big process because I think, I put a number, I say half the people out there don't even know what healthy is,
You're right.
right? And then the other half, like I always say, everybody knows McDonald's is bad for you, but I don't think they understand how bad it is. People understand you shouldn't drink alcohol. But, you hear this say, well, I always heard if you do things in moderation.
Yeah.
But if you eat McDonald's in moderation, with alcohol in moderation, with seed oils in moderation, with processed food in moderation, now you're moderation, like, what are you doing at that
Yeah.
point? It's not moderation anymore, but you convince yourself it is.
Mhm.
And you're right about that. Like, I know with my son, he looks on the back, if it has more than 3 ingredients, 4 ingredients, he doesn't eat it.
Really? He's a little kid.
Yeah, well, because he watches the
He
show.
watches you.
This
Good
one,
for him.
to
Very good, but to your point.
he's begging for one of these.
Oh, yeah, yeah.
Right? He goes to his mom's house and he's like, if it's not organic and it has seed oil, I don't want it. And then,
That's so great.
yeah, and she calls me up cursing me out because she got away from me for a reason and now she's had a clone of me.
Right,
So,
right.
which is, I have the last laugh, I guess.
But you know what? In thinking about buying food for your children, and people say to me a lot of times, "Yeah, but Whole Foods are so expensive," or healthy foods, but it doesn't have to be purchased at Whole Foods, right? It can be at the farm stand, an organic farm stand, or a bag of white northern beans
Yeah.
is full of protein, full of fiber,
Yeah.
and it's like $2. It'll last you. I think you have to go beyond the easy, right?
I think it's more than that too, because everything's greenwashed as well. You go into Whole Foods and you're like, oh, they have that bacon, mushroom something or whatever. And like, I don't know how healthy it is, but you look at it and you're like, oh, well, I want to replace pork bacon with this. And, so it's $20 a packet. And I think that's healthy, but really it is the whole food. And I mean, I think the flip side of it too, it's a lot more expensive to be unhealthy later on.
It is.
And, you're talking about like diets or, procedures or medication or whatever that
Yeah.
is. So,
Healthcare is the number 2 reason people go bankrupt.
yeah.
Yeah.
Well, this is why, you look at the system, it's like, are they trying to suck all the money out of you on your way out, right?
Oh.
So what's the dumbest anti-aging tip that you've heard?
I think the word anti-aging is the dumbest thing I've ever heard.
Mhm.
My philosophy is from the moment of our conception to the minute of our death, aging is the most natural thing to do, right? Um, it is how we pass our days that matters. So I'm trying within the community I serve to stop using that word at all. And I'll tell you how it frames with women. We were talking about women and longevity. And so what's happened is when we talk about men aging or men living longer, you say it that way, men living longer in society. What happens when George Clooney, the actor, turned 60, he and Brad Pitt got a photo shoot in the south of France showing distinguished aging. Like, oh my God, they're more vital than ever, blah, blah, blah. And all, it was beautiful. The picture of women living longer is invisible, decrepit, anti-aging, as if there's something wrong with us because we can't control time. So I like to, as you were talking about earlier, reapply the word longevity and health span to describing both men and women because that's what it really is. It's not anti-aging. But if you ask me the question, what's the most stupid hack that I've seen to try to live longer? I think thinking that taking 2 handsful of cellophane wrapped supplements is gonna ever replace a diet of whole, well-raised food, right? I think we're trying my answer is, I think we're trying to skip to the easy, to the extra, when we don't have our foundation together. We think that we're gonna supplement our way to building muscle. No, you gotta go lift some heavy shit, please, right? You think you're gonna supplement your way or any gadget your way to building a big heart muscle. No, you gotta pound out some steps, preferably sprinting. And then after you do that, then come on, let's augment. I'm not opposed to augmenting,
Yeah.
but only after optimization.
I mean, I don't think anybody's come on the show and have not agreed with you. No matter what people are selling, what they're doing, how they think,
Mhm.
it's that foundation is always there over and over and over
Perfect.
again. And it's the one message of all the messages that I've received that is loud and clear. Because you can argue about diets and
Mhm.
don't run, walk, walk, don't run, all this other stuff, but nobody debates that.
Yeah.
So it's a powerful message. Do you believe aging is a disease and can we cure it?
I know there are camps, aging and disease. No, I think aging is the most natural part of living. I think the hallmarks of aging, the pillars of aging, the 13 of them now, which I call in my writing time bombs, because if you don't diffuse them, if you don't have shields against them, they can explode and really kill you. Think, mitochondrial dysfunction and micronutrient deficiencies and all the time bombs. Um, those can become disease, but those are just part of natural chemistry. They're byproducts of metabolism, but it's letting those things get out of control. For instance, like having a huge senescent cell load, right? When cells go from healthy adult cells and they're supposed to turn on the genes towards programmed cell death or apoptosis, but do not because they're so damaged that they're just circulating around, not living, not dying. Well, unless we know that we have a senescent cellular load or what it even is, those cells will cause disease and cancer. So the lifestyle that decreases senescent load, maybe some of the supplements like fisetin and quercetin, which have some literature behind them, to say we can decrease that load, therefore prevent disease. So is aging itself a disease? I am not in that camp, but we get diseased from ignoring the natural metabolic processes and minimizing the damage that happens from that.
So you train elite athletes and aging patients. Who's harder to optimize, the NFL player or the 55-year-old CEO?
That's interesting. Well, the elite athlete has a smaller margin, right? They're usually optimized. I mean, the reality is that from the minute they wake up to the minute they go to bed, somebody is taking care of them, whether it's the trainer I used to be the medical director at the UPMC Lemieux Sports Complex, which is where the Pittsburgh Penguins, the hockey team skates. They had an executive chef that cooked every meal, including what went on the plane. So when we're optimizing that level athletes, the optimization is incremental, tiny. and they want it. So it's harder to get big deltas, but they want it, right? That's their job. They are all in. For an executive who has an executive presence and has gotten everything right in life
Yeah.
for a while, except their health, it may be a little harder because even though the delta is bigger, we can make profound changes. They're used to being in control. It's not, they've been this successful without that. There's a max min principle, right? I'm going to get the max out of the min. And sometimes you need to do max things to get the max out.
Yeah.
So
Cool, cool. So if you want to look 30 at 60, what's the minimum protocol, supplement, test, treatments? Give us like, a little.
60 at 30. Well, if you want to have big muscles at 60, like you did with your 30, you can. You have to eat enough protein and you have to lift heavy weights. If you want to have the cardiovascular fitness at 60 that you did at 30, healthy 30, some 30-year-olds have terrible VO2 maxes. And you gotta,
Healthy.
yeah, you got to train that. From a cosmetic perspective, the miracle, I'm almost 60 and I'm pretty happy with the way the 60-year-old skin looks.
You look great.
Is estrogen on my face.
Yeah.
Yeah, because we lose 30% of the collagen in our face as we age. And so many years ago, when I went through perimenopause, I started like, well, if we're putting estrogen on our body, why not put it on our face? And it makes a huge difference. So if it's purely cosmetic, that's what.
You don't recommend that for men though, do you?
Estrogen on your face, maybe not, but society is more acceptable of facial aging in men. But the same applies. If you want to be robust with big muscles and be vital at 60, you got to build some muscle. You got to get your testosterone tested because men lose testosterone. Even if your testosterone falls within normal ranges on a lab test are between 250 and over 1,000. Even if you're like 300, 400, that's normal, but you don't know what you were when you were 20. We don't test men at 20. I tell my patients and my sons, I'm like, get your hormone, so that we know when you're 50 and I need to supplement your testosterone, that I'm supplementing back up to your youthful levels. Because how this manifests in men, low testosterone is not only low energy and all the things that are commonly known, but in my orthopedic clinic, multiple tendon injuries, multiple tendon ruptures, inability to gain enough muscle, even though they're trying their hardest. So I test testosterone. So I think that's how it applies to men in my world.
I think everybody should be testing everything throughout their life just so they have a baseline.
I think so. Yeah.
What's the dark side of hormone optimization no one's talking about?
The dark side, I don't think there is a dark side to this. Generalities. I believe that every woman, if we're talking about women, is a sentient being with agency and deserves to have her own assessment. Not necessarily hormone level assessment, because in perimenopause it's chaotic and 1 minute your estrogen will be this, the next minute, but risk assessment as in what are your goals? What is your heart disease? What is your family's cancer history? All the things, not just a blanket statement that everybody needs it or nobody can have it, right? So that's number one. Generalization is not how hormones should be optimized. Number two, I think there needs to be a bigger and more profound explanation of why hormones were taken away from women in the first place. Before 2002, when the Women's Health Initiative study was published, more than 40% of all eligible women were optimizing their hormones, optimizing their bone, their muscle, their brain, all the things. The study of the Women's Health Initiative was designed and accrued older women. The mean age in that study was in the mid to late 60s. The question they were trying to answer was about cardiac disease, but the outcome of that study was that women get breast cancer with hormones. Stop the camera, right? Here are the real data. Even the physicians who ran that study have walked it back. But the fear mongering that they placed into society has put the baby booming generation women who were young women in 2002 in dire danger. they're the ones that we're gonna see with hip fractures, bladder infections that kill them. It's a disaster for them. But 2002, here's the data. In the control group, the risk of developing breast cancer was 3 in 1,000. 3 women in 1,000 developed breast cancer. These are older women. On the experimental group, those taking hormones, synthetic hormones, the risk was 3.8 per 1,000. So less than 1 woman in 1,000 more developed breast cancer. 1 in 1,000. Now, I am not diminishing that number. Breast cancer can be frightening and deadly. However, 1 in 1,000 is why generations of women are not offered the option. So the badness, which was the question you asked me, is women are being treated in generalities. Women are frightened to death to even consider optimizing something that can make them healthy, vital, active, joyful when paired with a lifestyle.
I mean, I think that happens a lot. The outliers tend to dictate a lot of treatment
Interesting, yeah, interesting.
for sure. So we kind of touched on this, but should we be doing blood work every month like pro athletes, or is that overkill?
Uh, I took care of a lot of elite athletes. We didn't draw their blood every month. I think people need a baseline in their youth, their relative youth, certainly by 40, hopefully in their 30s, um, just to see where their baselines are, and then annually. However, in my own longevity clinic, we test up front, implement a plan. The soonest we retest is 4 months because we wanna see real change, and it's all dependent on compliance, isn't it? So if they're completely compliant with all the plan, well, then 4 months is probably fine.
Yeah.
If we're skipping around and then there's no reason to retest. We're gonna capture the rest the same data.
If mobility is longevity, are all the desk workers just screwed?
Yes. You know what? You've heard it. There's so much data about how sitting is the new smoking and why, I'm encouraging everybody to get a standing desk. I dictate my charts standing. We know that careers in the same industry, for instance, this is a very old study, train engineers who sit in the front of the train all day have much higher incidence of metabolic disease than the guys who run up and down getting tickets all day, right? Same industry, the difference is mobility. So let's get up off our chairs.
3 tests every 4-year-old should be doing, but probably isn't.
40-year-old
Yeah.
baseline tests. I think they should be doing a complete standard lab panel. I think they should be doing a variety of inflammatory labs. I don't draw 200 labs because people aren't going to change 200 things. I draw a panel of about 24 that include inflammatory labs. We do fasting glucose, fasting insulin so that we can calculate the Homer IR. We know their lipid A and B so they know their genetic heart risk versus their standard heart risk. And then, I draw a senescent cell load and a intracellular NAD load for energetics, for micronutrients. Um, what was the question? Those are the last I do. I went off on a tangent.
I said 3 tests, but
Oh,
that's
3 tests.
yeah,
So basic labs, number 1, a VO2 max so that we know where we are, because if you do nothing to train your VO2 max, you will decline 5% per decade. And if we start low, we will cross the fragility line. And so if we know in our 30s that our VO2 max is 28, we've got a lot of work to do. But I did mine when I was 50 and it was either 45 or 50. If I keep up what I'm doing, I will never cross the fragility line. It's a value worth having. And then I think we need, and not everybody gets these, I think we need a body composition to know visceral fat, peripheral fat, and muscle mass, as well as one that's high quality enough to know your basal metabolic rate.
perfect. Is there one supplement you wouldn't take that everyone's taking right now?
Mm. You know, I take very few supplements. I take a basic stack. Um, I just wanna say that I'm gonna become very unpopular in this group saying this out loud, but I just think it needs to be more clear because people ask me all the time, I'm an orthopedic surgeon. For wound healing, uh, lots of my pro athletes take BPC 157, and this is just an example. They're adults. They can do what they want. I mean, there's good anecdotal data, there's good rat data, but I don't think the general public understands that sometimes we're going from research informed, not research based. And if people choose to do that, like many of our people choose to do that, they deserve to know the difference and not take it as dogma. So I take a very short stack. That's just my choice. But I think if people decide to do a variety of things, they just need to know that they're research informed and not research based. And they just have to investigate and be curious.
Perfect. So mobility or Botox?
Oh, are they mutually exclusive? Botox for facial beauty?
Yeah, I mean, you know.
Yeah,
No, what else?
mobility every day.
Okay.
Every day.
If you're not cold plunging, what's your excuse?
You know, it's not found to be that amazing for women. For men, sure, go decrease your inflammation. For women, it's the data aren't quite as good. Plus, I don't like my stomach cold.
Do you think most people are aging because they're addicted to comfort?
Most people are aging poorly because they're
Yeah.
addicted to comfort. Yeah. And I think, you know what? From a genetic perspective, I mean, I think we're programmed to survive, right? If our bodies don't know if we're living in the relative luxury of today or huddled in a cave, but what they know is that they're going to conserve and they're going to survive. So why do all the extra energy? Why all do the extra things if we're fine, right?
Yeah, yeah. What's your take on zone of optimal stress for longevity?
Um, is there a zone for optimal stress for longevity? And how do we measure that?
I mean, I don't know.
I don't know either.
So you're the expert.
Not on that.
So you've got one patient at 75 sprinting stairs and another at 45 breaking down. What's the real differentiator?
You know, we did a study looking, all my research has been on musculoskeletal aging. And so we've done those studies looking at the difference between, oh, we've done a whole series of studies taking the variable of sedentary living out of people's lives to see what we're capable of. Here's what we're capable of. And I'm going to tell you the protein that answers this question. If we take the variable of sedentary living out and invest in our mobility, not pro athlete mobility, but just regular exercise, we can preserve our bones, we can preserve our muscle. These are all studies we've done. I'm summarizing. Preserve our bones, preserve our muscles. We do not slow down until we're in our mid 75 in a significant way, such that an example is one of the guys I studied in the group was 50. He ran a mile in 3:34. The boy that won the state games the same year in a mile did it in 4:17. 40 years, and we only have 14 or a few seconds difference. The 70-year-old ran it in 7 minutes, so no one's getting lapped. So we looked to see what tied it all together. Why is a 45-year-old sedentary person breaking down and the 75-year-old guy's like doing his thing? It's because the contraction, it's many things, but the contraction of skeletal muscle causes a transcription of the longevity protein klotho. Klotho was named more than 30 years ago after the goddess that spun the thread of life. So we know that klotho is ubiquitous in the body, every organ needs it, and that without it, mice die old, very young. They're like very young mice, but they die old and broken down like this 40-year-old. So what we know from this study we did and many others that followed is that chronic contraction of skeletal muscle, we found that 75-year-old athletes had higher levels of klotho than 40-year-old sedentary people. So therefore, they have the longevity program.
Excellent. Excellent. Final question. If someone's already has joint damage,
Yeah.
is regeneration still possible? Or are we gonna send them for a full replacement?
Yeah, so part of my job is joint longevity. I'm going to do everything I can to preserve your natural joint. That starts with the broken record things I talked about. You got to be strong. Your butt, core, and hips need to be strong enough so that your bones aren't pounding together. The muscles are shock absorbers, number one. Anti-inflammatory nutrition is critical. Sugar is a toxin. It causes inflammation even in your joints. So if you want to be out of pain, you want to decrease the inflammation in your joints, we're going to cut out all that stuff that we've already talked about. Um, there are medical ways to decrease anti-inflammation, but the thing that I use very frequently to prolong natural joint health is platelet-rich plasma first. The dose that is researched in orthopedics is 10 billion platelets. They have to be counted. It takes about 120 cc's of blood to do that. But when you put that in, I can get 80% relief for a year or two from that. Then sequentially, if it worked, and we just do that again. If we need to ramp up, in my clinic, we use adipose stem cells, a little liposuction from the fat pads in the back. Adipose stem cells are very powerful. They're used for both of these things are used for tendon, ligament, arthritis. In those ways, we prolong the health of the natural joint. But listen, when the natural joint is gone, when the bones are starting to change shape, when you are giving up everything you love in life and starting to sit around and gain weight and become metabolically less healthy, total joint replacement in orthopedics is one of the most successful procedures to give you your life back, because modern joint surgeons let you ski, let you swim, let you do tennis and pickle. So in my book, after I've extended your joint life, if you have to get a total joint, I'd rather do that and have you active your entire life than sit around and turn into a mushroom and die.